So, a guy goes to visit his grandma. While they're talking, he eats all the peanuts in the bowl on the coffee table. As he's leaving, he thanks his grandma for the snack. "No problem," she says. "Since I lost my dentures, all I can do is suck the chocolate off of them." Alright, so that you don't have to end up like Grandma, allow me to share some of the things I've learned while working with a periodontist or gum specialist for the last 2 years. According to the National Institute of Dental and Craniofacial Research, 80% of American adults, yes, 80% of American adults, have some form of periodontal disease, which is the #1 cause of tooth loss. So in order to avoid periodontal disease and maintain good overall health, it's important to practice good hygiene habits at home, as well as to get regular professional cleanings. There's 2 main types of periodontal disease. But before we talk about that, we're going to talk about how it starts. Basically, in a healthy mouth, there's a V-shaped crevice between the tooth and the gums that's called the sulcus. In a healthy mouth, it measures 3 millimeters or less. We measure that with a tiny ruler called a periodontal probe. When you leave plaque on the teeth by not brushing and flossing regularly, it builds layers on itself and hardens and turns into calculus, also known as tartar. When you leave calculus on the teeth, it produces toxins which break down the attachment between the healthy gums and your tooth, and the sulcus becomes a pocket of 4 millimeters or more. So you have to brush and floss every day the right way. It may seem silly and it may seem tedious, but it'll save your teeth and maybe even your life. So once the healthy sulcus turns into a pocket, that's when you have, on this side, periodontal disease. Okay? There's 2 types of periodontal disease. The first one is gingivitis. Gingivitis is a mild inflammation that only affects the gum tissue. The warning signs are red, puffy, tender gums that bleed easily. So this is your healthy gum picture here. You see the pink papillas in between the teeth are flat and they look nice. Down here they're red and puffy. That's gingivitis. The second type of periodontal disease is called periodontitis. Periodontitis is more destructive. It now affects the gums as well as the supporting bone that keeps the teeth in your mouth. The warning signs of periodontitis are gums that have pulled away from the teeth, as in this picture down here, bad breath, and loose teeth. So periodontitis, unlike gingivitis, cannot be reversed, but it can be treated by a periodontist with different treatments. What she or he will choose depends on the extent of the damage. So the first step in treating periodontal disease is basically a deep cleaning by your hygienist. The specific name for that is scaling and root cleaning. Scaling is just scraping off the calculus or the tartar that's right above and just below where his gum line should be. Root planing is actually smoothing the rough spots on the roots that allow bacteria to accumulate below the gum surface. Often medications are prescribed in conjunction with the deep cleaning. Antibiotics help treat the active infection systemically, and antimicrobial mouthwashes such as chlorhexidine lower the bacterial load in the oral cavity. Finally, surgery might be necessary if the first 2 treatments don't work, or in the areas where they don't successfully treat all of the disease. The first surgery is flap surgery. And flap surgery is done by cutting an incision right along the gum tissue, flapping back the tissue to expose the roots and the bone, and basically cleaning all the calculus that's too far below the gum line for the hygienist to reach. Then the periodontist will suture the gum tissue back down so that it fits tightly around the teeth, reducing the pocket depth, and also allowing you to clean better in between your teeth at home. You can also do bone and soft tissue grafts, which encourage the growth of new bone or gum tissue. Sometimes you'll just do flap surgery, other times you'll do both together. So, now you're wondering, why should I be concerned about periodontal disease? Besides the fact that only 1 in 5 of us in this room today are completely free of gum disease, studies have also shown a link between periodontal disease and other serious health risks, such as heart disease, strokes, preterm or low birth weight babies, and uncontrolled blood sugar in diabetics. According to a 2000 Surgeon General's report, and I quote, "If left untreated, poor oral health is a silent X factor, promoting the onset of life-threatening diseases which are responsible for the deaths of millions of Americans each year."